You're recording, I'll go. In the other room, knock on the door so you can hear anything.
Hey, this is Lisa with Transformations Therapeutics, and today I want to talk to you a little bit about craniosacral therapy. April is craniosacral therapy awareness month, and so I wanted to start by giving you a video about what craniosacral therapy is, what kinds of things and treatments that craniosacral therapy can help with, and what exactly to expect in a craniosacral therapy treatment. So craniosacral therapy is a light touch approach that helps to relieve soft tissue tension deep in the body. It helps to relieve pain and dysfunction. The craniosacral system are all the soft tissues like the fascia and the muscles that actually the tissue that surrounds the central nervous system or the brain and the spinal cord. So as you know, with traditional massage, you may have like tightness around your neck, tightness in muscles that you can actually feel. Well, that tightness can also happen at the deepest level with the soft tissue or connective tissue called fascia that actually connects to the brain and the spinal cord. So as that tension happens, you can have dysfunction and problems at a really deep level in your central nervous system. So what exactly is craniosacral therapy? So if you think about how your heartbeat has a rhythm and your breathing has a rhythm, your central nervous system also has a rhythm. The way that craniosacral therapists are trained, we're trained to be able to palpate that fluid movement in the body by placing our hands in different positions on the body. When there are restrictions, the fluid doesn't go to that specific area. So if there's tightness in, say for example, you sprained your ankle and you're having problems, that tissue tightness I could detect if there was a problem. I could detect that by not feeling that fluid in movement in and around your ankle because of a possible scar tissue. So with craniosacral therapy, the reasons why someone would receive a craniosacral treatment in my practice would be, for example, neck and headache tension, migraines. So if you book for the headache relief treatment, I would be using craniosacral, but I also use it in combination with myofascial work. The reason why is that I can get that connective tissue and that soft tissue from the outside in and from the inside out through the craniosacral and the myofascial work. So I would use it for headache relief, I would use it for pain relief. Oftentimes people with fibromyalgia may use craniosacral therapy. Also, any kind of jaw dysfunction such as TMJ, D or temporal mandibular joint dysfunction. If you were getting treatment from your dentist or your chiropractor, that might be something that would be a valuable treatment to you in conjunction with seeing other practitioners. So what to expect in a craniosacral therapy treatment. If it is a traditional craniosacral therapy treatment, it's 60 to 90 minutes, whichever. Usually the first session I would go ahead and choose the 90-minute just because it allows me to be able to get a baseline and see what exactly is happening with your craniosacral system. You remain completely clothed. You get underneath the covers and get nice and comfortable. It's really relaxing, so it's awesome for stress relief as well. So I go to different what are called listening stations in the body to detect the craniosacral rhythm and see where there might be some tightness in the deeper tissues connected to your central nervous system. At that point in time, it's very light touch, and so you just don't even imagine that something that deep and profound is something that's sometimes it's starting in no more than pressure of my hands at the weight of a nickel. but it allows that deep tissue tension to release and helps with central nervous system and for relaxation, but for pain relief and tension relief. So this is Lisa with Transformations Therapeutics. I hope you come in and book a craniosacral treatment session, and I look forward to seeing you soon. Thanks so much and have a great night.